Menopause is a chapter in women's lives that brings a myriad of what can be debilitating medical issues that can last for more than a decade. It's an area of medicine that for years has been overlooked and underfunded. Isabella Jibilian of Rhode Island PBS Weekly has our story, which is part of our ongoing series, Unequal Treatment.
It was rage for no reason. The only one I wasn't mad at was the dog.
Artist Tanya Glover was 45 years old when she started noticing symptoms that she couldn't explain.
The anxiety, big time, that was the worst one. The night sweats, the irregular periods, the heavy periods. I just felt like I was kind of losing it a little bit. And a friend of mine said something about perimenopause. I'm like, what is that?
It's a familiar story for Dr. Mary Jane Minkin, a gynecologist with Yale School of Medicine.
Menopausal symptoms, perimenopausal symptoms, can be extraordinarily disruptive to women.
Those symptoms can include increased anxiety, hot flashes, migraines, insomnia, vaginal dryness, and changes in sexual desire. And Dr. Minkin says, all too often, they aren't taken seriously.
I just feel horrible for so many of these women who come in and they've been miserable for so long for no good reason. We have some great therapies for them so that people can lead totally normal lives.
But those therapies are going underused because the traditional treatment, hormone replacement therapy, developed a bad reputation in 2002. That's when Dr. Minkin says a prominent study called the Women's Health Initiative, or WHI, changed everything.
I remember where I was when JFK was shot. I remember where I was at 9/11. And I remember where I was on July 9th, 2002.
The study raised troubling questions about hormone therapies, including estrogen, which had been used as an effective menopause treatment since the 1940s. For the study, researchers divided about 27,000 women into two groups: women who had hysterectomies or given estrogen or a placebo, women who still had their uteruses or given estrogen and a synthetic version of the hormone progesterone or a placebo.
It was supposed to go on for over 10 years.
Dr. Renee Eager is the director of the menopause program at Women and Infants Hospital in Rhode Island. She explained a worrisome finding that stopped the study dead in its tracks.
After 5 years, there was noted to be a statistically increased risk of breast cancer in the women who took the estrogen plus the synthetic progesterone. That study made it onto the front page of the New York Times. It was the topic of talk shows. The number of prescriptions for hormone replacement therapy decreased by 85%. Those numbers have not rebounded.
Today, instead of estrogen, Tanya Glover relies on anti-anxiety medication for her menopause-related depression and anxiety.
It's taken the edge off. That's it, though. It's still there. I probably couldn't do a regular job. I don't think I could handle it. And that's not an option for a lot of people.
Did you ever consider hormone therapy?
I considered it. My doctor told me most insurances don't cover it. And it's pretty expensive. And, you know, you hear about the cancer risks, and I don't know who to believe.
What to believe about the WHI study has been the question for the last 20 plus years.
The actual increased numbers of breast cancer was only 8 women out of every 10,000 women. So from a clinical standpoint, it was questionable whether that was actually significant.
And the findings were skewed because the study included women in their 70s.
The average age of women enrolled in the WHI was 63. The average age of women going through menopause is 51. So you had these women who were way post-menopause.
It has taken decades for hormone therapy's reputation to rebound. Last May, a study published in the Journal of the American Medical Association found that hormones were safe for many women under 60.
For women who are at low risk and appropriate candidates for hormone therapy is very safe when you look at the risks versus the potential benefits associated with it. We no longer tell women that they absolutely are or are not candidates for hormone therapy, but rather have individualized discussions with patients and take a look at their past medical history.
But Dr. Minkin says many doctors are not prepared to give this kind of guidance after being trained under the flawed findings of the WHI study.
Because women stopped using estrogen in droves, most programs training residents in OBGYN and some other specialties basically stopped teaching how to manage menopause.
So they didn't think they had any good treatment options, and therefore they stopped teaching about menopause altogether.
Exactly. Even as of last year, 70% of the OBGYN programs in the United States were not teaching menopause management.
Even with new, safer treatments, 2 decades after the WHI study, many patients don't believe their symptoms can be treated safely. But there are signs that change is happening.
Why is such a critical part of women's health being ignored?
It's getting increased attention on social media.
Good morning, Miniverse. Okay.
Do your periods just stop when you enter menopause?
And in the highest levels of government. Last March, President Biden signed an executive order to expand women's health research, noting menopause as a particular area of interest.
This is a hot flash.
Now, a non-hormonal drug is available. It was even advertised during last year's Super Bowl.
It's a not flash.
As for Tanya Glover, it's been a long, turbulent phase of life.
How many years has it been now
At least 10.
of perimenopause?
I haven't had a period since last March, so I'm like a week or 2 away from full-blown menopause.
How does that feel?
I don't want to jinx it. But it feels like relief is right around the corner. I need that.
For PBS News Weekend, I'm Isabella Jibilian in Providence, Rhode Island.